Let's discuss the measurement of bioavailability. This topic is all about how we measure how much of a drug actually reaches the bloodstream. And we mainly use pharmacokinetic method and pharmacodynamic method. We'll start with the most reliable one, the pharmacokinetic method. It works on the assumption that there is a direct relationship between the plasma concentration of the drug and the concentration at the site of action. It is subdivided into two: plasma level time studies and urinary excretion studies. First, we will see the plasma level time studies. This is most common method. We give a single dose of the drug and then take blood samples at regular intervals. We plot the plasma concentration against the time to get a graph. So in that we are going with the single dose study. With the single dose study, a single dose is administered and blood samples are drawn at specific time intervals and analyzed for drug content. A graph is constructed showing the concentration of drug in blood at specific times so the samples were taken. From this graph, we'll get the three key parameters: Cmax, Tmax, and AUC. This is maximum therapeutic concentration or maximum safe concentration. This is minimum effective concentration. So we'll see the three key parameters. Those are Cmax, the maximum plasma concentration, which indicates both rate and extent of absorption. It is known as Cmax. It is measured in mg per liter per ml, mg per ml or microgram per ml. Then we have the Tmax, the time it takes to reach Cmax. This gives an idea of the rate of absorption. The lower the Tmax, the faster the absorption. Lastly, we have the AUC, area under the curve. This tells us about the extent of absorption or how much drug has reached the systemic circulation. Now, if we are doing multiple dose study, we give the drug for at least 5 half-lives to reach steady state concentration. Then we collect the blood samples, especially after the next dose, to calculate the parameters like steady state, like CSS max. So this is the graph you will get. After the first dose, the concentration increases till this side. Then after the second dose, it further increases like that. So after 5 to 6 biological half-lives, the steady state concentration will be achieved. Then we have the formulas. These formulas help to calculate the extent of bioavailability in both single as well as multiple dose studies. Remember these formulas. Urinary excretion studies. This method is based on the principle that the amount of drug excreted unchanged in urine is directly proportional to the plasma drug concentration. It is useful only if 20%, 20% or more of the drug is excreted unchanged. Example includes diuretics or urinary antiseptic drugs. This method is non-invasive method, so better patient compliance is seen. Then we have the method. How we collection of urine at regular interval for time span equal to 7 biological half-lives. Then we analysis of unchanged drug in collected sample. Then we have the three urinary parameters for single dose study. First one is dxu by dt max, maximum urinary excretion rate. It means the maximum urinary excretion rate. That's the urinary excretion rate. We get this from the peak of the excretion rate versus time plot. Okay, its value increases as the rate and extent of absorption is increases. Then we have the TU max, time to reach the maximum excretion rate, like Tmax but for urine, TU max. And we have the XU infinity, it is cumulative amount of drug excreted, which reflects the extent of absorption. It increases as the extent of absorption increases. You can see in the diagram that TU max is here, dxu by dt max is here. Okay, so XU is related to AUC of plasma level drug. Okay, then the extent of bioavailability is calculated by the following formulas. You can see on the screen. These formulas are used to calculate for both single dose study as well as multiple dose study. Here the XUSS is the amount of drug excreted unchanged during a single dose interval at steady state. Now, if blood and urine methods don't work, we go for pharmacodynamic methods. In this, we have the acute pharmacological response method. This is where we observe the drug effects like pupil size, okay, and ECG changes, BP, and relate it to time. But there is a downside. The effect might be due to metabolite, not the parent drug. So the bioavailability can be determined by construction of pharmacological effect time curve as well as dose response graph. Its demerits are a direct relationship between the pharmacological response and plasma drug levels is difficult to establish, and pharmacological response may be due to inactive active metabolites, okay, not due to the parent drug. Next, here we have therapeutic response method. It is theoretically most applicable method but practically not possible. In this method we see the drug is actually treats the condition, but there are problems too, patient variability, other medications and so on. So its demerits are physiological variations may be present between the patient, and since the patient may also consume drugs for other diseases, there are chances of drug-drug interactions. So to sum it up, the best and most reliable method is the plasma level time studying using Cmax, Tmax and AUC. But we also have urine studies and effect-based methods when needed. So if you like this breakdown, make sure you subscribe to our channel for more videos like this and share this video with your pharmacy friends. Thanks for watching.